Good day, everyone that's watching. This is a cybersecurity framework presentation for a medical institution called Augusta Medical Hospital. My name is Alan Mohendo, and I'll be your presenter tonight. An overview of Augusta Medical Hospital. It's a comprehensive healthcare facility with multiple departments and specialties. It holds electronic health records, and because of this, it has to have patient security data focus, both for finance and health, as well as the critical infrastructure protection in place. The framework selected for this alignment will be the NIST Cybersecurity Framework. The NIST Cybersecurity Framework helps businesses of all sizes better understand, manage, and reduce their cybersecurity risk and protect their networks and data. Here we see the three regulatory primary compliance requirements, which include the HIPAA, high-tech, the state regulations, and the industry standards. Meeting these standards requires significant investment in technology, processes, and personnel, but is essential for maintaining patient trust and avoiding costly breaches and regulatory penalties. These are the steps to meeting these standards, which include conducting a comprehensive risk assessment, developing a prioritized roadmap, establishing a governance structure for cybersecurity decision-making, allocation of resources, engagement of stakeholders, regular measure and report on progress, and continuous monitoring of the threat landscape. The priorities of the organization, which are the critical business needs, include patient care, which involves availability of health records, critical care systems, clinical systems, and emergency services. Then we have data protection. This includes protection of patient records, their financial information, compliance requirements, research data, and privacy controls. The third one is operational efficiency, which includes system integration, workflow optimization, resource management, and business operations. In summary, we have to ensure the confidentiality, integrity, and availability of patient data and hospital systems. We have maintained compliance with regulations, which include HIPAA, high-tech, and PCI DSS. We have to protect the hospital's reputation and maintain the patient trust. We have to enable secure data sharing with healthcare partners and research institutions. And we have to support the adoption of new technologies to improve patient care and operational efficiency. The identified vulnerabilities the institution faces would include unpatched softwares, weak passwords, no multi-factor authentication, unencrypted data storage and transmission, insufficient access controls, outdated and old equipment, limited updated capabilities, remote access, and VPN problems. Identified threats that the institution faces include ransomware attacks, data breaches, unauthorized access to patient data by external or insiders, social engineering, operational failures, compliance problems, phishing attacks, advanced persistent threats, distributed denial of service attacks, and cloud security risks. In order to manage these risks, we have to conduct regular risk assessments. We have to implement technical controls like firewalls, encryption, and the like. We have to develop and enforce security policies and procedures, provide security awareness by training or staff members, establishment of an incident response and business continuity plans. We have to do continuous monitoring, updating, work with medical device manufacturers to ensure timely and security updates and patches, carefully vet and monitor third-party vendors and cloud services providers, and also maintain compliance with relevant regulations. Here we see the implementation timeline for the immediate actions needed, which include framework adoption, risk assessment, team formation. Then we have the short-term goals, which are between 3 and 6 months, which include critical controls, initial training, basic compliance. And we have the phase 3, which is 6 months to 1 year. These are long-term goals, which include full implementation, advanced features, and optimization. For privacy implementation, collect only the minimum necessary patient data for treatment, payment, and healthcare operations. Obtain patient consent for data collection and uses beyond treatment. Provide clear notice of privacy practices to patients, and limit data collection to the actual purpose as required by the law. For disclosure purposes, disclose patient data only as permitted by HIPAA and on a need-to-know basis. Obtain patient authorization for disclosures outside of HIPAA exceptions. Implement data sharing agreements with third parties to ensure this. Audit trails and make sure to document each and every event. For data retention, make sure to retain patient data only as long as necessary for treatment, legal, and regulatory purposes. Securely destroy data when no longer needed. Establish a data retention policy and procedure. Make sure the data is securely stored, and make sure to archive protocols. The impact of legal and regulatory standards. HIPAA requires implementation of administrative, physical, or technical safeguards and mandates policies and procedures for data privacy and security. It also imposes breach notification requirements. High-tech increases penalties for HIPAA violations, extends HIPAA requirements to business associates, and requires mandatory breach notification and reporting. PCI DSS mandates specific security controls for credit card and data processing, requires annual assessment and attestations of compliance, and also imposes fines and penalties for non-compliance. Success metrics: we have security metrics, compliance metrics, and operational metrics. For security metrics, the incident response time, system availability, and control effectiveness. For compliance metrics, good audit results, policy adherence, and training completion. For operational metrics, we have system performance, user satisfaction, and process availability and efficiency. The implementation support resources include the team structure, which includes the security team, an IT department, department heads, and privacy officers. We need tools for security systems, monitoring tools, training platforms, and documentation. And also a budget for equipment, software, training, and personnel. Attached are the references for this research. Thank you very much.